Hello, I am Dr. Lawrence Smith, Dean of the Donald and Barbara Zucker School of Medicine at Hofstra, Northwell. Thank you for tuning in to Well Said. In a culture of community, scholarship, and innovation, the Zucker School of Medicine is dedicated to transforming students into doctors who will improve healthcare, inspire change, and better the lives of the people they serve. It is why we are pleased to collaborate with WRHU Radio Hofstra University to bring you a program committed to sharing expert discussion and insight on health and wellness topics important to you. Join us today and each week for a recommended dose of Well Said with your host, Dr. Ira Nash.
Hello, I'm Dr. Ira Nash. Welcome to Well Said. Today we'll be discussing the flu. I'll be talking with our guests about this flu season and how you and your loved ones can protect yourselves. We'll also be discussing the potentially complex interplay between the flu and the ongoing COVID pandemic. My guest is my colleague, Dr. David Hirschwerk. Dr. Hirschwerk has appeared as an expert on a number of our previous Well Said episodes, including those in our series on COVID-19. He's an infectious disease expert at Northwell Health and is an associate professor at the Donald and Barbara Zucker School of Medicine, and I'm delighted to welcome back to Well Said.
Well, thank you. Glad to be here.
So, David, I think we ought to start our conversation by explaining why it is we're going to be talking about the flu when we're still very much in the middle of an ongoing pandemic caused by a different virus, the SARS coronavirus. Why is the flu still important to talk about?
Well, we may have forgotten about the flu because we didn't really experience any influenza of much significance in our community last year. But we know that from roughly this time of year, each year, aside from last year, we do start to see cases of influenza. It often builds and peaks usually sometime around January, February, and then gradually comes down, and we continue to usually experience influenza in our communities through around the early part of May. And the reason it is so important is because if we have a flu season that even to some extent resembles the types of flu seasons that we have experienced in the past, that together with the ongoing COVID situation, it could really tax our healthcare systems and our communities.
So I think that's a great setup. Let me spend some time talking with you just about the flu, and then we'll come back to talking about the relationship between the flu potentially and COVID. So first, already in our brief conversation, we've used flu and influenza, but those are the same thing, right?
They are.
Okay. When we're talking about the flu, we're talking about a particular viral infection that is separate and apart from, say, the common cold.
Yeah, so when we are talking about the flu specifically in sort of medical jargon, we're really talking about the illness caused by influenza. And there's a couple of different strains of influenza. There's two strains of influenza A, and there's two strains of influenza B that are important. And when people become infected with influenza, the illness that they have, we refer to that specifically as flu. Now, the term flu is used a lot, and people might say that they have a stomach flu, and you know, we understand what is meant by that they have some type of an illness related to picking up a bug, and that causes a stomach-related illness. But when we're talking for this particular situation, we are referring to the respiratory illness caused by one of the influenza viruses.
And what does that usually look like? I mean, what does somebody with a genuine influenza infection feel like, and what do they look like to you as their physician?
A typical case is one that the virus infects the nose, the lungs, and people can have fevers, they can have congestion, sore throat, a cough, and then usually accompanied by body aches, and people just feel lousy until they recover.
And how long does that usually take?
And it depends. I mean, people who, for example, have gotten the flu vaccine will tend to have a shorter duration of symptoms than people who haven't gotten the flu vaccine. And so it could last anywhere between just a couple of days to as much as a week and a half to 2 weeks in more extended situations, typically in people who either have compromised immune systems or who have not had the flu vaccine for that season.
Those symptoms that you just described overlap a lot with the symptoms from COVID-19, right? So is there a way to tell the difference?
It's very hard to tell the difference, and I think that one of the things that is more common with COVID compared to influenza is that people tend to have a loss of smell or loss of taste with COVID. That can still happen with influenza, but it is more common with influenza. But other than that, there is a lot of overlap. People who have COVID, if they do have chest symptoms, they tend to have a dry cough compared to influenza, which can be a dry cough in the beginning, but often starts to turn into a cough associated with some phlegm. But even that, without doing a test, and it is important to do a test to distinguish the difference, it can be very difficult to clearly delineate the two different illnesses.
Let's talk about the importance of distinguishing them. Why is that?
Understanding what virus you're dealing with is important, mostly because of the therapeutics that we have available. So, for example, for people that have influenza, there are antiviral medications available. One of the common ones is called Tamiflu. And if we can identify somebody as having influenza, particularly if they have some underlying medical conditions or if they are really quite ill with it, and if we can give it within the first couple of days, then we would very much like to do that. In somebody who has COVID, there are therapeutics that we have available for that as well, and understanding what we're dealing with really does become important so we can best treat our patients. And not only is it important for treating our patients, but it's also important so that we could share with people who have had contact with that individual. Because what people may need to know about for the flu may be very different than what they need to know about for COVID, and the types of infection control kinds of restrictions that we may advise people of is different.
Yeah, and just to be clear, those antiviral agents that you talked about are different for the two different infections, right? What works for the flu doesn't work for COVID, and vice versa.
Correct.
You mentioned that people feel pretty crummy when they get the flu, fever, body aches, and so on, but it can be much more serious for some people, right?
It can, and there are classically a couple of groups that we do worry about more with influenza. One of those groups is our elderly patients, so those over the age of 65 to 70. If they become infected with influenza, they have a higher risk of developing more severe illness and possibly leading to hospitalization or secondary bacterial pneumonia, other problems that can affect the heart or other muscles in the body. There's also other people with immunocompromised status, whether it be from transplant or any number of other conditions, and we like to do what we can, of course, to protect those people, and naturally giving the vaccine to those people before flu comes around is something that we prioritize. And then also young children are vulnerable to developing severe illness associated with influenza, and it becomes extra important to try to get young children vaccinated as well as their household contacts.
You mentioned that one of the reasons it's important to distinguish a COVID infection from an influenza infection is that you may advise people differently about household contacts and things like that. Does the flu spread in a similar fashion to how we now understand that COVID spreads?
It does. It does spread in a very similar way. I think they both can spread by droplets. And when we talk about droplets for these respiratory viruses, we're talking about sort of larger water droplets that are expelled when we sneeze or cough or even speak. And the virus can live on those droplets, and those droplets can extend to roughly 6 feet or so. When we also think about COVID, we have recognized that there can be some airborne spread, and airborne spread means that those droplets, they can come in a couple of different sizes, and the larger droplets only go for around 6 feet, and that's a common way in which COVID spreads. But COVID also can spread by much smaller airborne droplets, which can stay suspended in the air, particularly in indoor environments, for a longer period of time and also for a larger distance. Now, the same can occur with influenza, but we believe to a much lower extent. We think that influenza predominantly spreads by these larger droplets, so this roughly 6-foot model that we've spoken so much about tends to be more typical of influenza. But again, airborne spread can happen, but probably not to the same extent as we experience with COVID.
And can you spread influenza even if you don't feel sick?
You can. Influenza tends to spread most efficiently within the first 2 to 4 days that somebody is symptomatic, but even before somebody develops symptoms, they are contagious. Usually within roughly 24 hours of the time that they start to develop symptoms, they are infectious during that period.
And you mentioned before that we speak each year about a flu season. Do we understand why flu is seasonal, meaning more prevalent in the sort of winter months, cold months, than in the summer?
Yeah, I mean, in the northern hemisphere, it is during roughly October to, again, the peak sometime in February and lasts through around May. The inverse is true in the southern hemisphere, and in the tropics, actually, influenza occurs all year. So some of it relates to some properties of the air itself, and some of it relates to the fact that in colder weather, people are driven more inside, and the virus can spread more efficiently during that time period.
You know, I remember last year when we were struggling with the kind of second wave of the COVID pandemic, there was a lot of concern that we were going to get hit by a simultaneous flu epidemic, and yet the flu was almost non-existent last year. Did we just get lucky, or what happened?
Well, I think we did get lucky, but I think the reason that we did get lucky had to do with some of the factors that really influenced the spread of influenza. So, and the following are true in general about how influenza spreads and did not happen to the same extent last year. So one of those is that people were not traveling from the southern hemisphere to the northern hemisphere as they may have typically done, and that cut down on the degree of introduction of the virus to our area. The other is that we were using masks to a large extent, not exclusively, but we were, and use of masks does cut down on the spread of all respiratory viruses. And the other thing is that school was not in session to the same extent as in a typical year. And when we look at who in a usual season becomes symptomatic from influenza, it's more common in younger people and in children, in part because those are the groups that tend to be vaccinated to a lower extent than our seniors. And in households, influenza spreads commonly once children become infected, and they can pick up the virus commonly in the classroom, and then they can transmit it within their households. And that was not happening to the same extent last year because school was not occurring to the same extent as we are accustomed to it occurring.
And what about the widespread use of masks?
Right, so in masks as well. So people were using masks to a much greater extent than ever before, and that was containing these respiratory droplets that we have spoken of, which naturally cut down on the extent of flu. So we did have some flu cases last year, but we waited and waited, and it never quite occurred, fortunately, because we did have a major surge of COVID, and I think the combination of the two would have really stressed our communities and our healthcare systems. I think it is nearly certain that we will not have the same good fortune with influenza this year, and we already are starting to see some influenza activity in our community.
And do you think that's directly correlated to the fact that kids are back in school and we are traveling more and all of those things?
Yeah, I think it's very much related to the things that we understand about how flu spreads, that we're not using masks to the same extent. We are traveling far more than before. And schools are open, and not only are schools open, but everything else is open.
Right.
And also, things have been, for example, curtailed on college campuses. So, for example, we know that at the University of Michigan right now, there have been almost 600 cases of influenza. Now, that's a significant outbreak, but that outbreak has been occurring over the last 3 to 4 weeks. And that's something that was not experienced anywhere to the same extent, even remotely, last flu season.
Yeah, we've been talking a little bit here and there about flu vaccines, and I want to focus our attention towards vaccination. We've obviously all spent a lot of time recently thinking about and talking about COVID vaccines. Let's talk a little bit about the flu vaccine. So how effective is that, and how does that compare to the effectiveness of the COVID vaccines?
So the flu vaccine is very effective, but to understand and to kind of appreciate what that means, I think we have to break it down a little bit, because I think in many ways we've not done a great job with the flu vaccine in explaining the benefit of the flu vaccine. And I think,
well, here's your chance.
Right. So here goes, and I'm a little nervous to get this right. But I think that the way that we have messaged it often was, it's important to get the flu vaccine so that you don't get the flu. And probably a more genuine way of expressing it would have been that it's important to get the flu vaccine because it does reduce the risk of you getting the flu, and even if you do get the flu, it won't last as long, it won't be as severe, and you'll also be less likely to pass it on to other people. And I think the reason that it's important to present it like that is that people may get the flu shot, they may still get the flu and feel like in subsequent seasons there's really no value in getting the flu vaccine because in previous season they got the flu shot and they still got the flu. But the flu vaccine is effective, particularly for our seniors, who it does reduce the risk of them developing severe illness. In terms of, let's say, the percentages or compared to not getting the flu vaccine, it's roughly 40 to 50% effective at reducing the risk of getting symptomatic influenza. And if we compare that to the success, let's say, of the COVID vaccines, it's actually much less. The COVID vaccines, especially when they first came out and in the early stages, and for those people who receive boosters, it's roughly 90 to 95% effective at preventing symptomatic COVID. So the influenza vaccine is pretty good compared to the COVID vaccine, but not as good at preventing any degree of illness. But it does significantly reduce the likelihood of developing severe influenza if you get the influenza vaccine. And, for our elderly patients and for our immunocompromised patients, it may only be around 25 to 30% effective. And some of that varies from year to year depending upon how well the vaccine matches up against the strains of virus that are circulating in our area. But unequivocally, it is important because it reduces the risk of severe illness and hospitalization and death.
All good things to prevent. You mentioned getting the vaccine each year. Why is it that we need to get a flu vaccine each year, and is it the same vaccine from year to year?
The major components are, I would say, similar but not exactly the same. The engineering of each of the vaccines is really based upon the type of strains that are circulating in the southern hemisphere. So there's always an effort to try to match up the components of the vaccine with what has been circulating, and because the virus changes each season, there's the need to make minor adjustments, and sometimes those changes are significant and sometimes they're to a lesser extent, but the influenza vaccine has minimal carryover to the subsequent season. But to get any degree of real protection, it is important to get the vaccine each and every season.
And so the people who develop these vaccines are sort of guessing, right, about what the particular strain of influenza is going to look like each year based on what it's looked like in recent years and what's been going on in the southern hemisphere.
Yes, that's right.
Interesting. So who should get a flu shot?
Well, everyone should. If you're 6 months old or greater, you should get a flu shot. And it's particularly important for our most vulnerable populations. Naturally, it's very important for our healthcare workers so that they're not passing it on to others. But really, there's not anybody from 6 months up who should not get a flu vaccine.
And is there a best time of year to get it?
It is best to get it before the flu season starts. So we're now toward the middle end of November. We're starting to see activity in our communities. From the time that somebody gets the vaccine, it takes roughly 2 weeks to develop the immunity that is protective. So at this point, really, it would be great if people who have not yet been vaccinated to go out and get their influenza vaccines. Even as time goes on and we get into the past the peak, let's say March, April, there's still value of getting the influenza vaccine because it continues until sometime in May. But since we are in November and we haven't started to have that uptick in cases that we likely will experience over the next several weeks, now is the perfect time to go out and get the flu vaccine.
You mentioned that some people are reluctant to get a flu vaccine because they feel like they got the flu anyway the last time they took the flu vaccine. I think you debunked that rationale very effectively. But it is true that some people do feel kind of crummy after they get the vaccine, right?
They do. I think that experience is probably to a lesser extent than what has been reported with the COVID vaccine. Some people with the COVID vaccine, their arm is really pretty sore and they feel a little achy for about a day and a half. That's not uncommon. With influenza vaccine, people get some arm soreness. Tends to be less than with the COVID vaccine, and they may feel a little bit of achiness, but that also tends to be more short-lived compared to the COVID vaccine. And actually, many people have virtually no side effects associated with the flu vaccine.
Just to put it out there, is it possible to get the flu from the flu vaccine?
It is not. So you can not get the actual flu from the flu vaccine. Now, if you go ahead and in a very active flu season, let's suppose you get your flu vaccine time in January where there's a lot of flu in the community, it won't be unusual if somebody gets the flu around the same time because there's so much activity of influenza in the community, and people may believe that they caught the actual influenza illness from the vaccine, but it's just related to the timing of when they received the vaccine.
So it's just a coincidence that they got sick from the environment shortly after they got the vaccine.
Yeah, correct. And we can, depending upon the season, anywhere between 8% to as high as around 15 to 20% of our population can become infected with influenza during a given season. So it's a high percentage of people who will get symptomatic influenza.
Now, we've also been talking about the importance of getting the COVID vaccine and to get a booster that was recently approved for all adults. Can you get your COVID booster and your flu shot at the same time?
You can, and it is fine to go ahead and do that. I fully recognize that some people might want to space it out by a little bit, and it's okay to do that, but it is recommended that if you have it available to you and you can get both in the same sitting, it is perfectly fine to do that. There's no medical reason not to do that. The decision to space it out is really purely a personal one that somebody may have. What I would say at this point is that knowing that we are embarking on an uptick in cases of COVID as well as an uptick in cases of influenza, that an opportunity to get either the primary series of the COVID vaccine, if that's necessary for you, or the booster, if you qualify based upon time for that right now. It's important to try to do that as soon as possible, as well as the influenza vaccine. So any opportunity to do it, even if it means getting both in the same sitting, I think is something that at this point in time is worth doing.
Yeah, I think that's a really important message, right? It's just kind of an opportunity that may not present itself again, so take advantage of getting whatever protection you can when you can get it.
Yep.
So let's talk a little bit more about whether influenza can become a model of what we think COVID will become. Some observers have predicted that the COVID pandemic that we've experienced won't ever really fully go away, but will morph into this sort of situation where the virus is always with us. People will be exposed early in life, which may provide some protection later, and we hope that many people will get vaccinated to prevent major complications, but it's not going to disappear. Do you see that as the future of COVID?
I think there are so many unknowns as to what to expect, and it depends upon many factors. And one of those is to what degree new variants of COVID emerge. And if we have variants that are not as virulent but remain around, then we'll probably have some degree of COVID that stays, but may start to at some point resemble kind of the common cold and may not turn out to be as dangerous as the strain is right now. If, on the other hand, other more serious variants spin off, then there's the possibility that we do have to contend with a more serious situation going forward, in which case we'll have to have adjustments of vaccines that help to prepare us, and hopefully more therapeutics that go along with that. So I think this could go in many different directions. There's been a lot of conversation about, let's say, the experience of the H1N1 influenza strain that emerged in 2009. That strain remains with us, and the current influenza vaccines contain components that resemble H1N1 because that H1N1 virus that initially emerged continues to be with us, but tends to not be one of the strains that causes as many problems as others. But nonetheless, it still remains with us, and our vaccines reflect that.
And so it sounds like you think that we may be, to the extent that we can predict these things, that we may be continuing to engineer the COVID vaccine to kind of catch up with changes in that virus over time as well.
I think that's one of the ways in which this could go, but I think that there have been so many surprises with this virus that I can also imagine other directions that this goes, and I think to predict it is very, very challenging to do. It is hard to imagine that we're not in some way contending with COVID over the next several years. To what impact it winds up having, I think is still so many questions to be answered about it.
Yeah, let me ask you another kind of scary question, which is, before this pandemic was a flu pandemic just about 100 years ago. What's the chance of something like that happening again?
Yeah, I think that, I would say that the experts in that area who study pandemics have very much pressed on the fact that it's not a matter of if, it's a matter of when something like that happens. And hopefully our experience with this pandemic and the lessons learned will be able to be applied. Hard to imagine another virus entirely, but unfortunately there are many people in our country preparing for just that. And I think certainly within our own health system, what we have learned from our management of COVID hopefully will be able to be applied the next time a crisis comes our way.
I think that's a hopeful place to end it. Let me just ask you one last question. other sources of information where we can direct people who are interested in learning more about the flu? Any favorites of yours?
Yeah, I think that the CDC website has done a really good job at presenting material both for healthcare workers as well as for non-medical people in our community that want to get information. It's updated regularly, including updates with statistics that show flu activity in our area. The New York State Department of Health does something very similar. So those are very good resources, and I would expect that our local newspapers also will have ongoing information about activity of both of these viruses, flu and COVID, as time goes on. And I know that within our own hospital system that there's always the intention of keeping our community updated with the latest activity.
Well, David, thank you so much for sorting this out for us. I think this has been great. I appreciate your coming back on the show.
Well, thanks for inviting me.
My guest has been Dr. David Hirschwerk. He's an infectious disease expert at Northwell Health and an associate professor of medicine at the Donald and Barbara Zucker School of Medicine. For more information about this program and to find past episodes, please visit sites.hofstra.edu/wellsaid. You can also subscribe to our free podcast, available on Apple Podcasts, Stitcher, or wherever you get your podcasts. Our listeners are welcome to send comments, suggestions, and questions to wellsaid@hofstra.edu. Until next time, I'm Dr. Ira Nash, and that's Well Said.